The future for prostate cancer diagnosis is very exciting. For the last 3 decades, we've been diagnosing men with prostate cancer, but blind to the location of where the tumor is. So we've been missing lots of cancers, and we've been finding very unimportant cancers that don't need to be treated. That is all changing now. We are using MRI scans before biopsy to target the lesion accurately and with precision. We can find the important cancers that need to be treated. We're finding fewer insignificant cancers. And more importantly, men can avoid a biopsy. We think about 1/3 of men can avoid a biopsy altogether.
With Rapid, the man has an MRI as the first appointment. This is analysed and reported on the same day. Men who have a very low risk of prostate cancer can be safely discharged without further investigation back to the care of their GP and do not have to undergo an invasive biopsy. Those men who require further investigation are offered a transperineal fusion biopsy. This new technique can reduce the number of samples necessary to make a diagnosis and significantly reduces the risk of life-threatening sepsis and other biopsy complications.
Mrr Fusion is a new technology where 3D MRI images can be overlaid on the ultrasound scan to create a very precise map of the prostate gland. This also shows with precision any abnormalities within the prostate gland, which can then be investigated and targeted by means of a biopsy. Within the rapid pathway, there are big advantages for the patient. First, patients can be investigated within 14 days of referral. All the investigations can be done within the same day, and people with a very low risk of prostate cancer can be referred back to their GPs.
With the rapid pathway, by using MRI as a triage, by not biopsying men who don't need a biopsy because they don't have a suspicious MRI, we are able to almost virtually eliminate the diagnosis of low-risk cancers. So in our early pilot data, we had brought down the diagnosis of Gleason 6 tumors from about 12 to 15% to about 2 or 3%. This is truly transformative, and I think will lead to better outcomes because we are going to cause less harm, and we're going to direct our attention to those men who really do need to have treatment. So in my role as the chair of NHS England's Prostate Clinical Expert Group, we are looking at how we can support centres across the NHS to achieve a better pathway for men referred in. This is what men want, this is what their families want, and this is what all of us clinicians want. The role of MRI before a biopsy now is beyond a shadow of a doubt. There are level 1 evidence studies that we in the UK have led and we in the UK have innovated on. And the West London RM Partners Rapid Pathway shows that it is possible to do. I'd like all centres in the NHS to look at their own pathways, to look at their imaging capacity, to look at their skill set in urology. Can you do a targeted biopsy? Determine how they can deliver a really streamlined, accurate, precise, but also less harmful pathway for their patients.
We have been overwhelmed with the response from our patients with the rapid prostate pathway. Patients are pleased that they can have all their investigation in one day. Some patients talk about it's a long wait, but they don't mind because at the end of the day, they know exactly what's happening with them.
RM Partners have a record of all the necessary information to set up a service, details of lessons learned, and documented the process. We'd be very happy to share these to help any other alliance set up their version of a rapid service.